It's also important for providers to ask about travel in somebody coming in with a febrile respiratory illness. They may have been to a part of the Middle East where there's ongoing MERS infections. They may also have been in Wuhan, China, or been close to someone who has been in Wuhan, China, and is part of the outbreak. We learned a lot from the 2014 Ebola outbreak as well as subsequent MERS outbreaks in how we prepare our hospital. And we've moved from a system of putting together new processes for every new infection that comes up to a more robust, forward-facing approach that focuses on the operations, on what we have to do. Basically, the number of infections that can exist are innumerable, and the number of ways that can present are innumerable. But the number of things that a hospital has to do is quite finite. And so we were able to move to a more operational approach that categorizes infections that we know, but also infections that we don't know of, to find a response based on what we understand about a new disease. We have core teams of nurses, physicians, respiratory therapists, laboratory medicine folks, really everyone who is needed to take care of a patient, as well as a designated part of our hospital with a designated laboratory, so we can properly take care of these patients while minimizing the risk to the rest of the population. So what we're seeing is a moving target, and taking the numbers with a grain of salt and understand that we don't quite yet fully understand the epidemiology, but what we do know is this is a new disease with the potential to cause severe illness, and are taking the appropriate steps to make sure that our healthcare facility is prepared for it. Obviously, those of us in healthcare, especially at a setting when we have a lot of international patients, we're closely observing the situation and making appropriate changes to make sure we're ready for this. Thankfully, we've been preparing for something like this for a long time, and if we were to see a patient, I'm confident that we'll be able to handle this well.